anything and everything in this field that interests me, that fascinates me. And then I'm sharing what I learn with everybody else on my blog, on my podcast for lactation professionals, FOR for lactation professionals. And so my intention today for this hour that I have with you, my intention today is for you to hear one thing that you can implement that's just going to turn that dial up one notch towards you becoming a better lactation consultant. So that's kind of the goal today, is let's learn one thing that y'all can implement yourself to help you become an even better lactation consultant or breastfeeding peer counselor. Now, one way that I go about learning everything in this field that I am actually learning is I actually sit and I shadow and I observe lactation consultants in action. So I go and I spend a day with them, I spend half a day with them, and I'm just a fly on the wall. And I see how they interact with their patients during consultations, and I see how the phone calls are going, and I see behind the scenes and how they're charting and what they do to prepare for the visit, what they do after the visit. And I'm just seeing how they're doing what they're doing, and I'm really paying attention to what they're doing really well. And then I take the things that they're doing really well and I document them and I share them, and I just kind of make a little note for myself so that when I start seeing patients again, I can implement some of these things that they're just crushing, that they're doing really, really well in their practice. Now, this past year, I shadowed one lactation consultant who really stood out on the communication side of things. She, Elysia Mason with Mason Lactation Wellness, she just is next level communicating with her patients. So we're going to talk about communication today. We're also going to talk about AI Scribe. So Natalie Blythe with the Milky Mermaid up in Wilmington, North Carolina, she uses this really cool tool that really I got to see in action, and I got to hear a little bit of her experience with it. And it just sounds like a really neat tool that really impacts her practice. And so I figured we could all learn a little bit more about AI Scribe together. Now, I have a job for you guys to do. Jump over, hold on, let me put this poll in here. So find your chat, which actually y'all should know where the chat is after earlier today. So that's wonderful. It's the little talk bubble with the 2 lines. So go to your talk bubble with the 2 lines, go to your chat, and in that chat, I am putting in there right now a poll, launch now, about AI Scribe. I want to know who's using AI Scribe. Is anybody actually using AI Scribe right now? Is nobody using it? Is somebody thinking about using it? So it should have populated in the chat. Let's see if it's there. Bum, 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 bum. It's yes. Good. Awesome. Thank you for filling out those responses. So that is going to help me actually while I am talking to Natalie about AI Scribe. That's going to help us kind of gear our conversation, knowing who's actually using it already and who's not. The other thing I really want you to do in that chat is while I'm talking to Elysia, while I'm talking to Natalie, throw some questions in there. If you have questions about Alicia's communication skills or about AI Scribe that Natalie's been using, her personal experience with AI Scribe, throw the questions in the chat and I'll punt them over to them while we're talking. Now, back in 2019, 2020 is when I was working towards becoming an IBCLC. And so I'm taking some college courses, I'm doing all the online work, I'm trying to get my mentor in line. I got my mentor and I'm learning from my mentors. And I created a vision board for myself, and it's on my phone right now. I still look back on it. And on my vision board, a big chunk of it was become a confident and world-class lactation consultant. And then I was like, okay, how do you become a world-class lactation consultant? What are the ingredients? So back in 2019, I came up with 3 ingredients that I think still hold up after 6 years in the field. So the 3 ingredients I found were priority number 1 is the patients. So no matter what I'm doing, whether I'm in the room with the patients, whether I'm stocking or charting or, doing the back end work or working with talking to other providers or talking to colleagues or whatever it is, if my patient nut diet is my number 1 priority, that's one ingredient to being a world-class lactation consultant. The second ingredient, in no particular order, the second ingredient is a wealth of knowledge. I have to know my stuff. If I'm going to be amazing, I have to have a good foundation knowledge base. So knowing what's evidence-based, keeping up with everything that's going on, having a really strong knowledge base is number 2. The third ingredient, outside of priority number 1 being my patients and having a wealth of knowledge, the third ingredient I came up with is communication. I have to be a fabulous communicator or else none of the other two really matter. Um, and when I say communication, when we're talking today about communication, I'm talking about the whole experience here, not just the words that are coming out of my mouth. I'm talking about the listening, the hearing, the understanding, the tone, the words, the body language. I'm talking about the whole experience of listening to other people and also getting your point across. And in my vision board, I actually wrote down names of people that I knew. I was like, okay, who are really, really good communicators and what makes them a really good communicator? And I didn't know Elysia at the time. I met her a couple years later. But had I known Elysia Mason, I would have put her name would have shown up on my vision board. And so I have had the privilege of working with Elysia, a little bit outpatient in the hospital for a good chunk. She used to be a labor and delivery nurse, and she's been IBCLC for many years now. And she was actually, I was one of her patients briefly after my first was born in the hospital. She was there. So I even experienced being a brief patient of hers. And when I tell you she's exceptional at communicating, I am 100% confident. I would bet big money that every single person listening in on this right now is a good communicator. You're not in this field for more than a minute working with these parents who are running on 30 minutes of sleep and stressed and worried and concerned. You're not in this field for long if you're not good at communicating with them. So I'm confident that every single person here is already good at this. But when I say Elysia's next level, she's just, I've observed a lot over the years. I've observed a lot of lactation consultants. I've observed doctors, nurses interacting with patients, and she's just good. And I was trying to figure out what is it that actually gives her just that next step up. And she's got, I think, two things that are rare to be really, really good at, both of them together. She's good at giving direct, clear instructions. So she's good at being very direct and very clear with her words. And she's also good at listening, letting the patient feel heard, understanding the situation. So she's good at kind of both sides of that coin. And I think that's kind of a rare skill to be that good at both of those different dynamics. Now on her website, a couple of her patients have also noticed that she's really good at this. One patient on her testimony said, when you work with Elysia, you feel seen, heard, and loved by her calming and supportive presence. Another one said, what stood out most was not just her wealth of knowledge, but her remarkable ability to provide guidance in such a warm, encouraging way during a vulnerable and confusing time. So some of her patients have noticed this superpower of hers as well. So what we're going to do today is Elysia's here with me. I want to learn from Elysia. I want to figure out what is it that she's doing that I might be able to take and tweak some of my ways that I'm communicating to make me just turn that dial up one notch to make me be just a little bit better of a communicator. So Elysia, thank you so much for being here today. I've got a couple questions for you that we're going to try to pull out some of those skills that you have.
Okay, great. Thank you for such a beautiful and wonderful introduction. I really appreciate it.
Yeah. Now, when it comes to communicating with your patients, both speaking and listening, this back and forth, the whole experience, is there someone or some resource that has impacted the way that you communicate with patients?
Yeah, so I started practicing yoga and mindfulness about, I guess, in my early 20s, almost 20 years ago. And through that practice, I realized how important breath is to both the mind and the body. Obviously not simply just as an oxygen source, but also as a way of connecting to ourselves. So if you allow breath, that means that you're also allowing space. And when you hold space for yourself, you create the room to hold space for others as well. I've also just reflected and noticed that as women, our voices are not always heard. And as clinicians, especially in a busy hospital setting or office setting, we know we have so many patients to see, moms, babies, only so much time to do it. And that's on top of charting and phone calls and everything else that we're managing. So I think as women and also as clinicians, we've been sort of subtly trained to take a deep breath and then say everything we have to say all at once before we get interrupted, before someone asks the next question, before we get which part of the spiel we're on, and we're going a mile a minute. And when we're doing that, I don't know if you noticed, like when I took that deep breath in, my shoulders kind of came up and I tightened down. And when we're communicating in that way, we can unintentionally take up all the space in the conversation, in the room, and we leave less room for the patient to process, to respond, to ask questions, or just like as you were saying, just to simply be heard. So I breathe, and I breathe with intention. I give myself permission to slow down, to take up space, to allow silence. And because I create that space within myself, I thereby create more space for my patient.
Are you consciously aware of that, the breathing, while you're working with a patient?
Yeah, so I'll notice that like my energy, my patient is going to feed off of my energy. So if my patient is tight and tense and all that, I just try to kind of relax myself. Um, and so I kind of like will take a slow, deep breath in and just kind of relax and see which places that I can soften. And especially if a patient is telling me something that might be super personal, obviously it's personal, we're dealing with lactation, but something that might catch me off guard, or I might be concerned about their safety, or, they're in a lot of pain, or whatever the issue or whatever the situation may be. If I notice that it's something that's very stressful for them, that maybe I feel connected to in some way, or I feel I can allow myself to feel stressed about it, I'll take that deep breath while they're speaking and just kind of soften myself and allow myself to kind of be more open.
That's amazing. And that's, I know, something I've never thought about doing, is just being aware of my breathing or my muscle tension. Because, sometimes I can be tense and I'm like, just, it's okay. Trying to create a calming atmosphere while I'm tight and trying to do, to get through everything that I need to get through.
Yeah.
So I never
So
thought about
intentionally
that.
slowing down, and you're still doing all of the things, but you're creating a little bit more space.
Absolutely. Now, if I wanted to improve my listening skills so that the patients feel heard, what would you suggest?
So I would suggest using attentive language, asking open-ended questions, and reflecting on what you've heard, validating their story and what's going on for them without automatically agreeing with them, and not rushing to fix the issue, whatever the issue is. Because sometimes a patient needs to feel understood before they're ready to hear recommendations. So don't rush to fix it. Just allow that space. Ask what they need. Would you like me to listen? Or would you like some ideas about what we could try? You can leave room for questions. Instead of ending with, do you have any questions? You can say, what questions do you still have on your mind? Or do you have any concerns that are going on for you as we're talking? And then summarize what you're observing, what they're saying before moving on to the next thing. Saying, let me be sure that I understand what's going on for you. And I think the take home here is making a patient feel heard doesn't necessarily require more time. It requires presence. Listening to understand rather than to respond, acknowledging what they've told you, and giving them space to finish their story is really crucial in allowing the patient to feel heard. So yeah, that's what I would recommend for listening.
Absolutely. And you said something about not agreeing right away. So kind of acknowledging
Mhm.
without agreeing with what they're saying. Do you want to elaborate on that? Like what might that look like or how
Yeah.
you do that?
So you, for instance, if a patient was saying to me something like, I didn't have much milk with my last baby, so I'm not expecting that, and I'm just going to plan on supplementing. You can acknowledge, hey, that sounds like it was a really tough situation for you the last time. Can you tell me a little bit more about that? And then you can kind of figure out, okay, was this a medical reason? Was this, they were encouraged to have their baby sleep all night and, we're doing sleep training methods? Were they, going straight to formula with somebody giving them the baby a bottle of formula, not pacing them? Like you can kind of tease through the weeds, um, acknowledge that this was a difficult thing for them to go through without agreeing, yeah, I definitely think you should just, yeah, I totally hear you. That makes sense. If you choose formula, then you choose formula. That's okay. You can kind of figure it out and say, and then in that instance say, hey, I'm hearing this. Um, is this something that you want to do, or do you feel like that you just have to do it because this is how things went the last time? And tell me more about that. It's always about finding out what the story is. So acknowledging that this was an experience, but not necessarily jumping to agree with them.
Absolutely. Yeah, so it sounds like you acknowledge them and then kind of ask a follow-up question instead of saying, "Oh yeah, absolutely. That's how it's done." Okay, what if we're going to stay on this listening train, if I'm gonna take it one step further, maybe somebody wants to be listening and understanding. Like my goal, I want to be listening, I want to be understanding. That's my goal. But I find that my patients aren't always very open or communicative with me. So one example is when I worked at the pediatrician's office and the hospital, our patients would fill out the Edinburgh postpartum depression scale, and so I would have a glimpse of how high their depression and anxiety feelings have been the last 7 days. But then they show up and they present cheery and happy and great. And so that gives me the thought that if they're having a high EPDS, they're not presenting that to me, that means they're probably not being very open or communicative with me. So I wonder if there's something, if you find that a patient's just kind of blocked off or not wanting to open up to you, is there any like skills or tactics that you try to help them open up to you more?
So for this example, I think again, we're kind of going twofold, right? So if their EPDS is high, for example, except they're presenting cheery and like everything is fine, that tells me that they're masking, right? That doesn't necessarily mean that that's what they're feeling. So then it's a question, is this their baseline that they feel like they have to take care of everyone else? My job is to make them feel taken care of. So what can I do? Um, so the first thing that I would do for myself and what I would challenge others to do also is to examine your own language and your biases. So ask yourself, is there something that I'm saying or doing that could make this patient feel judged or dismissed or not enough? Do they feel rushed? Do they feel like I'm truly listening? Do they feel like I'm a safe space? So, this is our language and our biases, that this is personal, right? So it can be something really uncomfortable to reflect on, but it's incredibly important, not only for your own personal growth, but also for improving your clinical interactions with your patients. Um, and then the second is relaxing your body. And again, this goes back to the breath. So patients often sense tension in our posture, our facial expressions, our voice, and our overall presence. So if you're going into this patient's room and your expectation is, I'm going to see a super anxious mom, and you're seeing a not anxious mom, is your energy giving off, this patient's lying to me? Am I being, critical? How am I presenting myself? Like, you can, be thinking all of these things, but, what's your energy? Um, so, when we are physically relaxed, like I said before, we kind of create more space for the patient to relax and communicate with us. Um, and we talked a little bit about this before, how do you relax? And I talked about, my mindfulness, meditation, yoga, and all of that. But if I'm like super tense, what do I do in a moment when I'm really tense? So personally, I do a technique called progressive muscle relaxation. And you can practice this at home. It's just like a really good way of understanding where you personally hold tension in your body. Um, and then you can realize, okay, I hold tension in my shoulders, or I hold tension in my jaw. So I'm going to breathe into that space and I'm going to relax it. So does that look like, wiggling your jaw around a little bit, maybe slowly taking a deep breath in? A full, obviously, head to toe meditative progressive muscle relaxation is not possible when you're sitting with a patient. But you can notice just on your own time where it is that you tend to hold tension, and then you can intentionally release it. Those small changes change your posture, your energy, your ability to receive information. And the more, physically relaxed and present you are, the more space you allow for the patient to be heard, and for you to respond with greater clarity, with greater confidence, and with greater respect for the patient and their current situation. So yeah, I would say challenging our own biases in our own language, and then relaxing our body into a space where we're able to receive and give information with clarity.
Those are two great things that I can personally focus on myself in order to help other people kind of open up instead of. So those are controllable things that I can do to help other people open up, which I really appreciate. Now, okay, let's flip to kind of the opposite side of the communication spectrum. If I wanted to improve my confident, clear, direct instruction to patients, and now this is definitely something I think more seasoned professionals who have been in this field longer, I think they're better at this than the newbies. So I know I've gotten a little bit better at that clear, direct, giving instructions, giving advice, but it's still a struggle at times. So if I wanted to improve my confident, clear, direct instruction to patients, what would you suggest?
I would suggest slowing things down. Just slow it down. You can be clear and confident while still allowing space for your patient to be their authentic self, right? So once you see them being their authentic self, you recognize, you understand who they are, where they're coming from, give yourself also permission to be authentic. And that authenticity creates genuine connection. While also allowing you the space to communicate instructions with confidence and clarity. So a good way to think about this, or a practical way to think about this, is connect first and then direct. So connect and then direct. So you don't have to become overly formal in your presentation as a lactation consultant, but you also don't have to soften your instructions to the point of ambiguity. You can be warm and authentic while saying exactly what the patient needs to know.
So you found if you make that connection first, then it's better received when you're giving the clear, direct instructions and advice and telling them what they need, the knowledge that they need to have.
Yes, yes. Because you're allowing space for them to be their authentic selves, and then you're meeting them with authenticity. Um, and it's so much, when you're authentic, you're so much more natural. You're so much more confident because you're being yourself. You're not putting on airs or being performative.
I would
So
imagine you're more
authenticity.
relatable that way too.
Yeah, 100%. 100%.
Okay, last question for you. Let's see which one we wanted. Oh, how about, okay, let's just kind of pull on that thread a little bit more. So we're talking about confidently imparting knowledge to the patient.
Mhm.
What about when you come across the patient or the knowledge when that the parent might not be happy with? So maybe babies just struggling, and we're like, we gotta triple feed or formula or whatever it is, or
Mhm.
maybe something else is going on, and you're imparting knowledge or imparting advice or information that you think is just they're not going to be super excited about what they're hearing. Any advice in those contexts or those situations?
Yeah. So let's think about why they wouldn't be happy about what you're saying, right? So let's say it's, we're going to have to supplement, which means that, or your baby is born early and you need to pump, or whatever the case may be, right? It's a lot of times I find that when patients are not responsive or they're giving you the back it up, it's because they don't feel respected in their autonomy. Um, they have a loss of sense of control over a situation, perhaps. Um, and that lack of control breeds feelings of, you know, um, discourse, essentially. So I would say that in that situation, your confident, clear communication really needs to center around patient autonomy and consent. Um, and so asking a patient permission to do something, to do an exam, or let's just go with exam for example. So when you're asking permission to examine someone or their baby, you're demonstrating respect and you're demonstrating safety, which in turn bolsters the patient's confidence in you. You're demonstrating respect for their body and for their choices. So let's think about some examples. Of course, always ask permission before you're touching a patient or examining them or their baby. Is it okay if I examine your breasts now? Then explain what you're doing. This is very basic kind of stuff. Give your patient control by setting expectations and setting boundaries. In like, one of the things that we talked about that you liked following me was, I always ask a patient, would you like hands-on or hands-off assistance today? Okay, I'm going to touch your breasts now. My hands might feel a little bit cold. Just let me know if you're uncomfortable in any way, or if you'd like to change to a hands-on or hands-off approach. Always giving them clear instruction about what you're doing, permission to do it, and then checking in on them and making sure they're okay during that appointment or interaction, right? How are you doing? And then respect the answer that they're giving you and adjust yourself accordingly. So this allows you to begin your interaction with them directly and confidently, while respecting the patient's autonomy. Acknowledging their autonomy can help reduce any concerns that they might have about an authoritative judgy, pushy clinician. Helps them build trust and confidence in you. And again, opens that space for a more genuine connection.
That makes sense. Thank you so much for your insight. There's definitely a lot of things that I hadn't considered when I think of like the whole communication experience. So
Yeah,
I really appreciate you being here today. Thank you, Elysia.
Yeah, thanks, Suzanne. Thank you for having me. I really appreciate you asking me to be here today, and I feel very honored that you respect and enjoy my practice so much that you asked me to be here. So I really appreciate you as well. Thank you.
Absolutely. Thank you. Now, speaking about communication, our next lactation consultant who's jumping on here, I was shadowing her and she said something that just blew me away. I was like, all right, I'm writing this down and I'm remembering this. She had a patient in front of her who baby was, I don't know, coming up on going to the couple month well check with the pediatrician. And the mom was worried that she was going to get there and pediatrician was going to tell her that she had to give baby formula. Mom was just sharing that concern with Natalie. And Natalie said, that is a very logical fear. And it happens to a lot of people and it sucks. But you, da, 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 da. And then she went on to explain why this specific, like mom didn't have to worry about that. And it really stuck with me, that verbiage that Natalie used with that patient, because she validated her concern. She's like, that actually is a logical fear. And like, you're not crazy for thinking that. But then she went on to tell her, you don't have to worry about it because baby's gaining a ton of weight and you've got a ton of milk and all those things. But I just love that she validated that fear first before jumping straight to don't worry about it. Now I shadowed Natalie Blythe. I got to see 2 different initial consults with her in her office. She's got a private practice in Wilmington, North Carolina. She started back in 2018 after about a decade in the business and finance field. So we have a podcast where I talk to her a lot about kind of her background and her experience in starting her own private practice with that background. And one thing that stuck out to me, so I'm sitting there, fly on the wall, observing her lactation consultations. They're both initial and back to back. And when I tell you 20 minutes, 30 minutes, 40 minutes, I checked the clock, 30, 40 minutes with both of these families at separate times, she is just sitting there. She's sitting at her chair, or she's sitting in her grandma's sweet little rocking chair that she has in her office. Mom and dad, or mom is sitting in this plush, cozy love seat. Dim lighting, there's pictures of babies and mermaid decor in her office. It's just very quaint and cozy and a very comfortable atmosphere. And she's sitting there for 30, 40 minutes just talking to these moms. Now, baby obviously came in happy and content and sleeping, so we weren't worried about getting baby taken care of. But she wasn't typing on her computer. We weren't doing vitals. We weren't taking notes. We weren't running through a checklist. They're just talking. They're talking about her birth experience. They're talking about her concerns, how breastfeeding is going. 40 minutes, 30, 40 minutes. Like she's got nowhere else to be. Like she doesn't have a bunch of charting to do. Like she doesn't have another patient coming up next. And it was just really good to see that comfortable environment that she created. Now, one little reason that she's able to do that is because she does use AI Scribe. So I talked to her today. I got to see both of those consultations where she used AI Scribe, and I got to see kind of how it turns out afterwards. And I got to talk to her about what she thinks about it. And so we're here to just tell you her personal experience using AI Scribe. Now, AI Scribe probably has a ton of money that they can go get their own marketing people for. So we're not here to market it or sell it for you. I'm not making any money off AI Scribe. Natalie's not making any money off AI Scribe. We just thought it would be really helpful if you are considering or it as a tool for you guys to possibly consider. I thought it would be helpful for you to hear a firsthand experience of a lactation consultant actually using AI Scribe. Yeah. So Natalie, thank you so much for being here today.
I'm excited to be here. Thank you for inviting me.
Yeah.
I don't do many things like this anymore, so it's kind of a treat.
Awesome. Trying something new.
And I appreciate you saying and all the things that you said. And one thing I just want to add is like I am so far from an AI person. If anyone, like I went to high school before the internet was around. And so it took me months of another provider that I share my space with here. I work inside my office is inside of Family Tree Chiropractic, which is a pediatric chiropractor who specializes in newborns. Is brilliant. But she kept saying, Natalie, you really need to try this. You really need to try this because I was drowning a lot of the time in charting, and it was keeping me up at night. And I also, if I was to see a lot of clients in one day, it can get really tricky because, as Suzanne was saying, that time initially when she was here and we were sharing those consults together, if you don't start out having a conversation and becoming a, a friend, or somebody that can feel like they can be, it's a safe space that they can confidentially show their true selves and their true feelings, it's impossible, in my opinion, to help someone if you don't really speak their language. Like, you have to learn their language. You have to learn what is really at the base of their concerns. Is it some pressure from other people? Is it a little bit of postpartum OCD issue? Where is it coming from, and why is it happening? Before you can ever even figure out how to talk to someone about how we can help overcome that challenge. Like, you got to, and everybody's so different personality wise. And so what I find in my practice, and it's not like I should do that because I do need to make an income. However, I do block 90 minutes for initial visits. And the reason I do that is because I find it's impossible to really go through the birth story, the labor and delivery. What trauma did they go through there? Um, and then acknowledge that, because a lot of times these are things no one has acknowledged for these moms because they have gone to the pediatrician, they haven't gone to their OB follow-up yet, and they're just like at home, and they haven't had anyone ask, "Are you okay? Tell me a little bit about how your birth went and what your expectations were," and all these things. And then you can really build a relationship with them that helps you as a clinician to determine, where do we begin? Where do we start? And what kind of plan is this person going to actually be comfortable with? And then saying, hey, we have some options here. We're going to work together to come up with a plan that's going to work the best for you and your baby. And that is also going to include rest for you.
I get that. Don't
But
forget that
anyway,
rest.
so as far as the AI scribe goes, I've been using it for about a year, and I'm not promoting an AI scribe. But what I have found over all my time of using it is that it shockingly has made me a better lactation consultant. And that was something that I really was not expecting at all. Mainly because I was like, okay, and I pay for a HIPAA compliant, and the reason I chose the one I use, which is Heidi, I can just say that, right?
Yeah.
Is because I use the EHR platform for my private practice. That is Practice Q, Intake Q. I don't know if anyone's familiar with that, but when the AI scribe kind of thing came out for providers, it was connected. It was the one that was integrated in with my EHR that I was already using. Now, that's why I was like, oh, this is integrated. Okay, cool. And then, of course, once I started using it and did the 2-week free trial, I run into, oh, this is integrated for practices that have 1,000 providers, and it actually costs $3,000 to integrate it. But since I had already learned that platform and I don't have time to retrain myself, because let's be honest, most of us don't, I don't have an IT department here. The IT department is me. Um, I just continued because I just didn't have the bandwidth to learn another one. So I did a private plan that didn't integrate with my EHR. So the only extra step there really is I have to kind of copy and paste my SOAP note, my care plan. Um, and before we really dive in, I saw a question in the chat about how do I let people know that I'm using an AI scribe. So it's really like, when I started looking into it, that was kind of intimidating to me because I was like, how am I going to say? so I'm going to record all of our conversation. And then, it can sound a little bit, but actually what I say is what I feel. And that is, and you can also build this into your consent and intake forms, just a little blurb so that then it's also written out and they're signing it. But let's be honest, my consent and intake forms, depending on if I'm channeling through my billing partner or not, some of them are very long, and a lot of people I don't expect to read all the information. So I always just start out and say, when I have my phone and I go in, so it's an app on my telephone. I have tried using an iPad, I've tried charting during my visits. It just doesn't work for me. It's too distracting. It makes me lose my place with where we're at. I love to have the opportunity to have an undivided conversation and not have to sit there, and I'm a pen and paper gal, write down each little detail that I think is important and then have to like look back up and then go back to where we were. So with the AI scribe, it is really kind of mind blowing. And I know it's kind of controversial, but I'll tell you, when I realized that you either got to jump on the wagon or you're going to get kind of left behind, um, I realized that I realized I'm not as bad of a communicator as people I've thought I was in the past, because it does lay out all. It takes the dialogue. You could actually read through the whole transcript if you want, which I don't do, because there's a lot of just funny, back and forth, candid conversation that I try to do as well and during the consult. But it will extract basically the data. And as long as you are honest in the very beginning of the appointment, hey, I use an AI scribe. It takes the notes for me so that I can have my undivided attention on you. And then it will extract all the important data specific to this lactation visit and create a care plan that's very much more comprehensive than what I would even be able to do. And it's HIPAA compliant and it's not stored data. Um, and so usually people are like, oh, absolutely. By all means, sometimes when I see other healthcare providers that are my clients, they're like, oh, tell me more about this. I want to do it. um, but another thing that I want to mention is it's made me a better lactation consultant because it's made me realize kind of my flow, and it's made me more efficient at asking these questions that are super important and not missing them. And so, I mean, over the years of doing this, every mother baby dyad is completely unique and different, as we all know. And so our brains are always going, there's no solution that works for every mother. And so what this AI scribe does, it doesn't come up with a plan for me. It doesn't come up with ideas or concepts. That's the point I want to get across is it takes what I'm saying in this conversation I'm having throughout, and then you set your own template up, which if I can do it, anyone can do it because I am really bad at technology. So you can just say, hey, I really want this data to be extracted. Birth and labor, how did that go? Where was it? What was the birth weight of the baby? What were the initial challenges? Those are the type of things that these templates are built in to them, and the AI will just generate the template you need by you typing in what data you want to make sure is included in your plan or in your SOAP note. So it's easy to create the template and you can cater it to however you want it to be. You do have to go back and make sure that is accurate though. Sorry, I just dove in there, Suzanne. You guide me. What
I
else you want
love it. I love it. That's awesome. Okay, so lots of benefits that you kind of talked about. Are there any benefits that you were expecting that didn't pan out?
No,
Okay.
no, actually. And I'm saying that because I'm the kind of person that kind of goes into things with very little to low expectations because I do think that's an important outlook to have to be happy in life. But I kind of went into it very sus, as the kids say these days.
Yes.
Um, or did they? They used to say that. But I was just there, like it was a free trial, and I encourage anyone that wants to give it a try. There's several different scribes out there. I haven't had the time because I've been like, okay, maybe I need to try another one. It's just kind of like I've gotten so used to the way this Heidi works. Heidi, like she's my friend. Um, and what I want to say too is that because it's an app on my phone, when I'm doing home visits or when I'm doing an office visit, all it really entails is you download the app. I mean, the pain is the multi-factor authentication. You know what I'm saying? So when a patient comes into my office or when I'm doing a home visit, before I get to the door, I'll go ahead and pull the app up, go and do not disturb, have it pulled up and ready. So I just hit the button that says start session. And so as soon as I go in, I'm like, hey, I'm going to use this AI scribe. And they also, like I said, are signing the consent form that is already in. So technically, I just cover it both ways because I want to make sure it's clear that I'm doing this. I haven't had one time where someone has had any concern or issue with it. And so that was a unexpected that was easier than I thought it was going to be. But when I went into it, I really hadn't have a lot of expectations other than, okay, I'm going to try this. I can tell her, Sam, my doctor I share space with, that I tried it. And then when I did, I was like, oh my gosh, now I can see 3 or 4 initial visits in one day, and I can still have these amazing care plans and notes, and I can edit them, delete them. I can even say, can we make the tone of this a little warmer? Or, so it's something that is going to be around. I don't really see it going anywhere. And I know that like with AI and the environmental concerns behind it, the thing for me is if I'm going to use it, I want to use it in a way that's going to benefit my patients, my clients, and make me a better provider. And I also want to say this, because when you hit the record button, and then when you leave, you just got to remember to hit stop. Otherwise, it'll keep recording for hours, and then you have to go through and figure out my conversation with my kids or whatever, delete all that. But at the end of the day, it's all very nicely formatted. I put in the patient's name, and then each session I have with them, it will automatically like link, and it only stores the data for a certain amount of time, and then it just deletes it.
It deletes it, but you
Um,
keep the whole transcription and you keep the notes that it extracts from the
I
transcription. You
just
keep
keep
those
the
things.
notes, like at the soap note, like if I'm channeling it through insurance, like the soap note, and whatever's in I actually take the note out, and then it eventually just gets gone from the storage and AI land, whatever that is.
Conscious. Yeah.
But I want to also just like to think, I don't know, this is a hard thing to talk about, but with the Lindsay Clancy trial, and I think I had mentioned this to you, Suzanne, like for me, I've been watching a lot of that on court TV, and sometimes I have to turn it off because it's hard to watch. But these providers that have been interviewed in that trial, their notes are being completely dissected to a
Mhm.
very granular level. And one of the things that I saw in there about the psychiatrist that was treating her, who was interviewed, that did not know what the Edinburgh postnatal depression scale was, her notes were really disappointing. And well, I said this, but I didn't put it in my note, and I did that that not that AI would solve the problem here, but it would be interesting because it would be much more, you would be able to know what
Much more
more
thorough note.
comprehensively what was
Yeah.
discussed during those
Do you
visits.
keep your transcriptions? So like it transcribes the whole entire like back and forth words. Do you
I don't
keep
even go,
those?
honestly, it would take forever because there's so many
Okay.
words spoken
Hmm.
during the visit.
Yeah.
I don't really bother with that, but it takes such specific details that I would not include in my plan or my soap note. So,
And then you
just
have
little
that to
things that are
transcript.
said that like matter, but aren't important enough if I was writing down things to write. And so I'm just saying this because it's a thought that has crossed my mind as I've been following that and thinking about how important our notes are,
Hmm.
and how we forget, like, sometimes I'm up at midnight, um, catching up because right now I've had consultants that were working with me as contractors, but right now I'm a one-man show. And so it's just, if you get it, you get it. And a lot of times these notes that I'm trying to get done at midnight when my brain is very fatigued, they're not as thorough as they probably should or could be. However, they are now. And the one downside is when you forget, when you get used to using it and then you forget, you leave your phone in the car or, and then you're like, okay, ooh, brain got to get like,
Turn it
especially,
back
and
on.
if it's a very complicated case, which I mean, I have a lot of, especially I just did the inducing lactation with a patient, it's helped a lot with learning for me and learning how to get better at my communication skills and learning, I need to talk more about this, or I need to, because it's basically telling you what kind of communicator you are and what you're covering, because it's just extracting the points that you tell it are important based on the visit. It's not conceptualizing a plan. It's not saying, oh, okay, she said this is wrong with her, so this is what her plan's going to be. I'm coming up with all of that information. It's articulating it in a much better format that's more comprehensive and over time kind of fits my personality. I can make it warmer. I can make it more clinical. But you can also use it to write a letter to a pediatrician. There's a lot of different templates. It's not just like the soap notes and the care plans. And so for $100 a month, if I can see more of the patients in my community that are looking for help, because we don't have a lot of lactation consultants here, and we have a lot of the population spiked during COVID here in Wilmington, North Carolina, then why wouldn't I do it? I guess the risk versus the benefit to me, the benefit has far outweighed the risk here. And I know it's like it took me, I'm telling you, at least 7 months before I would even agree to give it a try. And I had someone pushing me to do it because they're like, Natalie, you're killing yourself here. This is going to make your life so much better. And she was right. She was right.
What
And
was your emotional journey? Because you said you had like some hesitations or were a little.
well, I guess that at the beginning, I just didn't really understand that. Like, I'm like, but I want to be my best. I want to be a good provider, and I'm all about learning all the time. And so I'm like, I just didn't understand what it did. Like, I just didn't really get because like you can go like Chat GPT, for
Mhm.
example, which I tell some parents to use. And I'm always like, don't chat GPT when it comes to like, okay, if you want to look at the different bottle flows and different bottles, that's a great thing if you want to put it in it. Because I always recommend typically the same bottle, which I love, which is the pigeon bottle. Just a little, not, they're not endorsing me. I just love that bottle. But if you wanted to, like for parents, I'm like, if you want to kind of look and see just how different the flow rates are in these different bottles and how overwhelming. That's why I tell parents, like, there's no way you can't be overwhelmed when it comes to introducing a bottle if you don't know anything about bottles, because there's a million makers. They never have the same flow, even if it's number one on this nipple, number one. So I'm like, you can go and chat GPT. Hey, please provide me with, how fast is the flow rate on a Dr. Brown's nipple on a number, things like that. That's chat GPT providing me the information. So when I thought about an AI scribe in my mind, it was more like that kind of format. Like I'm like, what is this? How is this going to help me? But once I realized it was more about how it's just taking, because I talk a lot, clearly. But but it takes all the most important things, and it made me realize what I could be missing. But it also was surprising to see, man, I do cover a whole lot during
Yeah.
during these visits, and I am pretty thorough. But it's also a great thing to look back on when I have a follow-up and it's like, oh, wait, where did we leave off last time? And then it gives me like I can go look and it's a very easy find in my EHR. Like once I've downloaded it in my EHR, then I don't go back and look at it in my Heidi app anymore. Does that make sense?
Yeah.
But you can use it to generate, if you want to send a letter to the pediatrician because you're concerned about weight gain. For me, it's more about it saves me the time of I will write an email and rewrite it 10 times before I send it. It's a problem for me.
Uh-huh.
And so this really takes that it articulates things and it saves me the time from articulating what I want to say and how I say it, but not what I'm saying.
Mhm.
Does that
So it's not giving you
It's not giving me any
telling, it's not telling
ideas
you what
or
to say or telling you what to do. It's just
that's
pulling everything that you said in that consultation and organizing the words, basically.
that's exactly right. That's exactly right. And then if it's like a little bit too clinical, if it's a mom that's like having super sensitive, is very sensitive and is having a really difficult time, I can say, I would really like to adjust the the language here to be more candid or more compassionate or and so it's more about just like not having to think through how to say, I already said it, but it's
Yeah.
like it'll articulate it in a way that is much better, especially when my brain's fried at the end of the day, to be honest.
And you can take those notes and hand them to the parents. You can send it over for
Uh-huh.
P's. You store it in your EHR so that you have it
Yep.
for, yep.
In case I get
That's amazing.
audited or what have you. But that's another thing is for me, it's taken a lot of peace. It's given me a lot of peace of mind because if I were to get audited or get my notes or my like it's very clear. It's extreme. There's not a lot of questions around anything that was said,
Uh-huh.
because it comes directly from the conversation.
Those are some things I wouldn't have thought about. I wouldn't have expected to be able to learn about my ability, my communication as a lactation consultant, but that's really
And
neat that
that's
you're able to
exactly where
reflect
I
on
was at.
that better. Yeah.
hmm It's been a shock to me, honestly,
Uh-huh.
and it's even more shocking that I'm even here talking about it because, because it's like people would think I'm the last person that would ever be, and I wouldn't be comfortable talking about it if I mean, I'm a very authentic person, and if I didn't feel like it has helped me in a way that like, and it is a tool that I have learned to use that has helped me almost more than most anything
Wow.
in my private practice from a time management standpoint, but also, like I said, just making me learn a lot more about how I can communicate better and breathe better. Like, let's all talk about how amazing Elysia was, and what she was saying, because it
Right.
is important to take these breaths and have these moments where you're just like, okay, so tell me how you're feeling about what we've talked about so far. What are you comfortable with? And like then you have to take those pauses during the consultation, and this also can help you realize that too.
Absolutely. Well, thank you, Natalie, so much for sharing that tool with us. I think it's just an amazing tool, and it was really cool to see in person how it played out. And so it was really good to talk to you about it and kind of learn just more about that as a tool for other lactation consultants to use.
Thank you for having me. This was a real honor. And I just love that the South Carolina Breastfeeding Coalition, we got to get ours back together again over here in North Carolina
Yeah,
because we've kind of been ever since COVID. It's a little but I also keep missing the meetings. But thank you for having me. I really appreciate you inviting me. It really does mean a lot. And if anybody ever has a question like randomly or they want to hear something, my email, I think my website's being redesigned, but feel free to send me a message on social media. The Milky Mermaid is the name of my practice. And I'm happy to answer any questions or to help you if I can.
awesome. Thank you.
hmm
I am going to put one last poll in our chat here today. Let me pull it up here. Here it is. Let's see. Launch now. All right, I launched one last poll for you. So my intention today was for you all to hear one piece of information that you could implement to turn that dial up one notch towards you becoming a better lactation consultant. I have personally found when my motivation is really high or my why is really high, it's easier for me to make changes. I found if my motivation and why is, just fine, but not super high, one way that I can actually follow through with the change is having an accountability person. So like actually telling somebody, oh, I'm going to make this change and then having to talk to them again. So I am going to be your accountability partner. I need y'all to pull up your calendar. It can be on your phone, it can be on your iPad, your daybook, whatever it is. flip to next week, Wednesday, September 2nd, and just put 2 things in that calendar. Put my email, sandersibclc@gmail.com, and then put 1 word for a reminder for that one thing that you want to implement from today. So maybe it's, I'm going to focus on my breath while I'm with my patients. Maybe it's focusing on relaxing your body. Maybe it's, I'm going to look into AI Scribe. Maybe it's, I'm going to do a free trial. Whatever it is, put that one word on there in your calendar for next week, and put my email, sandersibclc@gmail.com, in your calendar for next week. And this time next week, send me an email, and I'll be your accountability partner. Thank you so much. That poll I have is really just a selfish poll. I'm curious to see where lactation consultants are showing up, so I know where I should be putting all my energy in to reach other lactation consultants. But if you have any questions or any concerns, I'll put my email and also Elysia and Natalie's website in the chat here, so that that you have easy access for all that. But thank you so much for having me, everybody. I really appreciated today.
Thank you so much, Suzanne. That was amazing. That was great. We learned so much. I certainly would always feel like I need a little help with charting. It does take a long time. And, I know at our institution, there is some charting help available. Like they have some AI tools, but I don't think we've explored them yet. So that's something that would be interesting to do more of for the lactation team. Listening to Alicia's communication skills, I mean, she's just really great techniques to keep in mind and to start practicing. So thank you, Suzanne. Thank you for doing these interviews. Thanks for just a brilliant idea to kind of bring people on here and share these techniques. And, we know we can get more of that on your blog too. So thank you. I'm going to introduce our next speaker. Our next speaker is Angie Brewster Benson, and she has the pleasure of holding the titles of mom, military spouse, and chief financial and operations officer for the Chamber of Mothers, the nation's largest nonpartisan nonprofit organization focusing on maternal health, paid family leave, and medical leave, and childcare. She has a decades-long career in business strategy, consulting, and public policy analysis, combined with the lived experience of raising 5 kids, and that makes her deeply passionate about building systems that work for moms and families. So welcome, Angie. Thank you for being here today and talking to us and sharing with us some information about Chamber of Moms. Just to let you know, we have started the recording button, so that is on there. Welcome.
Thank you. This is a really awesome group for me personally to be able to speak to. I do have 5 kids. Really quickly, this has very little to do with Chamber, just my own gratitude to you all and what you do. My oldest, I was only able to make it 8 weeks breastfeeding before it felt like I just couldn't do it. I had twins after that, and that was the first time I saw a lactation consultant. And because of her and her work, we went 14 months. And then when I had subsequent children, 2 more, I think I knew again immediately to ask for a lactation consultant. And then it was the fact that I was not stressed about it because I knew that, again, my oldest was fine. He was fine. I was able to make it past a year with both of them as well. And I credit that, again, 100% to having access to a lactation consultant. I think for that one too, the next one I saw, she told me that at 8 weeks, they're just gassy. There's a lot more gassiness, and that's what made me stop. I just felt like there was no way I could help my oldest. So I'm so grateful for what you do in that work, and I hope you get told often enough how vital it is and how important it is for babies, for moms. I also just looked forward to those meetings because it was my postpartum contact to the outside world. So I'm so grateful to you and what you do. Back in my chamber hat, I'd love to tell you about Chamber of Mothers and what we do. We are a nationwide organization. I have a little presentation here. I'd like to see if I can get it. Yeah, there we go.
It loaded. Perfect. We can't hear you. Are you talking? Let's see.
Let's see. Stop.
We
Now
can
is the audio working?
So we can see the presentation. We can't hear the audio.
Okay.
Let me see if there's anything on my end.
Let's see. Oh, here we go. Maybe if I do that. Okay. Can you hear me?
I can hear you. Yes.
Okay. Okay, we've got it. Thankfully we don't do technology. But we are the nation's largest nonpartisan nonprofit that works in maternal health, childcare, and paid family and medical leave. We do have 53 chapters across the country, in 38 states, and are adding more really rapidly. We have two, or have had two here in South Carolina. I am in Bluffton. So we have had a Bluffton, Hilton Head, and then Janet, who was originally going to be able to do this presentation, is in Charleston and heads up a Charleston group. We've recognized that we want to be able to bring in moms from Florence, from Columbia, from Greenville, all over the state. So we've consolidated into a South Carolina chapter, and are really excited about what that lets us do for reach, to make sure that we are getting to as many South Carolina moms as possible. We focus on advocacy at the state, local, and federal level, and that our chapters are these places where moms can feel community, and work together to be advocates. We like to say that no policy experience is needed for this. And it's about turning our lived experience into political power. So as we say here, moms control up to 85% of consumer buying power. We're a third of the labor force, 15 trillion in spending power. If we were able to really unite moms as this voting bloc, as this group that is informed and ready to go out and advocate, what an incredible power source that is. And so we really work at bringing these three pillars together. These were chosen purposefully because we know that all three of these things have voter support of over 80%, that there should be federal investment in these things. So maternal health, paid leave, and childcare, voters overwhelmingly agree that the federal government needs to be involved here, and that we see that across political lines, across regions, whatever spectrum you want to look at. These are the three things that we know can really support every mom across the country. Three pillars, and that we work in a truly nonpartisan way, looking for where is the advancement going to come from, and recognizing that we continue to push for, I'll say in meetings sometimes, like, if I could wave my magic wand and create universal plans for all these tomorrow, my God, I would do that immediately. While we work for and push for that, working for incremental change across those pillars where we can. And these are our theory of change, is that it comes from these three things. There is this element of real advocacy, getting out and encouraging and teaching and empowering mothers and people who love mothers to go out and ask for this change and work for it. And then there's this idea of really organizing people in those efforts. And then we really focus on shifting the narrative around motherhood, that motherhood is not a niche issue and mom's issues are not somehow sidelined. These are American issues. And our CEO, Erin Ehrenberg, who also lives in South Carolina, she's here in Hilton Head, was just recently asked to come speak at the House Democrats National Roundtable for Healthcare Affordability that was convened by AOC and Underwood and a few other House leadership Dems. And their question was, how is this helping towards healthcare affordability? And Erin's incredibly eloquent message was, if mom isn't well, no one is well. And maternal health care has to be pivotal to national health care. And really wanting to continue that shift in that narrative that these are not specialty issues. If moms aren't healthy, none of us can be healthy. So we do that by building up this chapter work. And then we also go to Capitol Hill between 6 and 12 times a year. We go as a national leadership team and meet with equally Democratic and Republican representatives to have these meetings where we talk about these issues and we bring stories right from our moms to their offices. We have specific legislation we ask them about, and we've also started bringing our leaders and our members from across the country with us. In February, we brought 20 moms from across the country right to their representatives to talk about these issues face to face in a really powerful way. And we'll continue to do those kinds of meetings. Also, please, I'm someone who hates just talking. So if you have questions, please feel free to ask, or I'll try and watch the chat as well. I definitely would love this to be a conversation more than me just like yelling and talking at you. So we, as this says, 52, we've added another since this slide, 53 chapters in 37 states. We have over 100,000 members. We reach between 4 and 20 million moms online every month. And we really are focused on continuing to bring these issues up to the forefront. And this is really a big part of what local chapter work looks like. It's encouraging moms to know that none of this requires a policy background. None of this requires knowing we have moms who come in and say, like, what is a bill? Like, start me at square one. And that's what we love to do, is really inform and arm moms with that kind of knowledge to just say, all you have to do is come in and bring your own lived experience. And we help shape that into that political advocacy. And that we know too that I can go into a senator's office with all the data in the world, and I am a data person by education and training, and that'll help a little. They're not going to remember the percentage I leave them with. They're going to remember the story from the mom that I brought in who had experienced stillbirth and loss and what that looks like. The mom who had no paid leave and had to go back to work 2 weeks after giving birth and had horrific complications from that. That's what they're going to remember. So we really try and empower people to know that you having a lived experience is, I'm going to try not to say this 100 times, that is political power, and wanting to make sure that we're able to encourage that and lead towards the most effective ways to use those stories. So at these meetings, a big part of what we do is explain the advocacy process, the legislative process. That's different, right? It's different in South Carolina than it is in Arizona, than it is in Texas and New York. So really setting meetings explaining that and what that looks like, and then having advocacy actions built into those meetings that people can do. Sometimes it's postcards, sometimes it's looking through voter guides. We do a lot of, we have Bordeaux and ballots is a favorite meeting where we're literally having some wine and we're looking at who's on our ballot for the upcoming election. Ways to make this all approachable and something that we do in community. And that we're really looking at making this digestible and something that anyone can do. And again, I don't want to just keep talking at folks. So if there's anything that would be helpful to go back over, very open to questions. I can keep going into kind of how we look at what local chapters do action-wise. I also have a couple of great stories from here in South Carolina. So I want to take a quick pause and share one of our federal bills in the lactation space was the Babes Enhancement Act that passed early this year. And this is a bill that is going to require TSA to have a publicized process for safely handling breast milk and supplies going through airport security. It is something that was brought to us from an advocate who had for years tried to get this passed. My favorite part if you know anything about politics, my favorite part of the story is that our Senate champions for this bill were Senator Tammy Duckworth and Senator Ted Cruz. So we like to say if you can bring those two together on anything, it's a pretty phenomenal win. So this was a process of bringing data and information to offices, both Democrats and Republicans, and explaining that this is a problem. So bringing mom stories who had this happen, had breast milk or supplies either taken or dumped or tainted through the security process. And then we brought in TSA experience of officers who, just didn't know what to do. And the fact that they needed clarity around it, brought doctors in to explain how important making sure that process is clean and healthy is, and then bringing a lot of women in and building a really big social media and push campaign around it, and telling chapter members who to call and what to say, and got that passed in about 6 weeks, which is really pretty phenomenal. Here in South Carolina, we worked with one of our moms here in Hilton Head runs a bereavement support group for infant loss. And she had a mom who had experienced stillbirth, and her employer was the school district and would not give her any leave from the process, and actually sent a horrific email saying, well, you don't have a baby to care for. So this mom came to us and said, this just doesn't sound right. This sounds like something we should be able to fix. And we partnered with Wren for that project, our Hilton Head chapter, our Charleston chapters, and Wren. We got the AG to send a letter that said that, yes, your maternity leave should apply to stillbirth. And now there's a bill in its final stages in the legislature to make that official as well. As an example of how we like to do this process of gathering stories, identifying legislation or legislative fix to a problem, and then tracking that through the process. Also included in this is making sure that we are bringing experts. So I would love for any of you to feel like you'd like to join us in the South Carolina chapter, but I also love finding partner organizations to tap for that kind of expertise. So when we're looking at a lactation bill, how do we make sure that it includes what you all know it needs to include? And so that we're only pushing things that are actually going to be additive to South Carolinian moms' lives. In this process, once we know we want to take action, there's all these different ways we can do it. We can meet with legislators directly. We can write powerful op-eds or support letters. Janet Bates, one of our leaders in Charleston, wrote an incredible op-ed about childcare for the Post and Courier. And then story sharing and just knowing how powerful that really is. We have a Denver chapter that's in the middle of this childcare story campaign where they've collected over 150 stories from moms and dads and how lack of childcare has impacted them. And then those stories are becoming part of a public media campaign to push for some kind of childcare legislation there in the next year. And just how important it is to do this work together in community, and how we never want to overlook how vital that is to people staying in the work, and recognizing that just having community is also a really important part of this. Moms knowing that they're not alone in their experiences, and that doing that is incredibly powerful. So these are a little bit more about the things that we try and do through this process, how we decide what kind of legislation we look at, and then how we track and look after. I realize this looks like a lot of information. These are things that we do within our meetings, and just to look at how we structure that as a group. So this is that Denver campaign around childcare, and the process of giving testimony, which our two moms from Hilton Head did for that stillbirth bill, and how, again, vital it can be to just share voices. So I like to say I was born into politics. My parents actually met as interns on Capitol Hill. My dad was a lobbyist for a long time. I worked on the Hill in the summer in college, and I'll be the first one to tell you, most offices, if they get 5 calls about something, they've noted it. If they get 10 calls about one thing, it goes on the list to go directly to the congressperson. So really empowering mothers, and again, people who love mothers, to know that it doesn't take a lot to make sure we're continuing to get these messages to lawmakers and decision makers. And then joining with others. So these are, again, through here, some more ideas of things that we've done. We really like to do an element of helping people understand that there's lots of different kinds of what we call change makers. So not everybody is meant to go into a meeting and talk brass tacks about legislation. Not everyone is meant to host the meeting. Some people work better just bringing people together. Some people, it's sharing their stories. That there's lots of different ways to suit every individual person towards this goal of doing advocacy. I know advocacy can sound like protest. It can sound like, again, gray suits up in Capitol Hill, but it really is something that we want every mom to feel like is within their power to do. That's the bit of my my formal spiel about what we do. If there are any questions, again, I would love to be helpful with sharing information. I'd love to share out how to join the South Carolina chapter if that's something you'd be interested in, and more information about bills that we're looking at here in South Carolina that would be within the lactation space or within all of our pillars if that's of interest. We also work really hard on our Substack to just share this kind of information from experts. We have within our board and our advisory committee some really leading experts right now. We're talking a lot about maternal mental health with people who that has been their expertise for decades, being able to go through and explain the nuance of that and make sure that moms are getting resources that they need, given that being a topic of a lot of conversation right now. But I really appreciate being able to be here and share. And I know that, again, I love talking and conversation a lot more than speaking at. So if you have questions, I'll leave my email and stuff in the chat too, and a link about how to sign up. But I'm just so glad to be here and share this.
Thank you so much for sharing. That is really interesting, what you talked about, your organization, the work you do, and how important it is. I mean, like you said, all of these things are issues that mothers have, and we need to work together to get them done, right? So,
Exactly.
uh, I have to confess that, I've heard of your organization, but I haven't explored it very much. So I personally very much appreciate you coming and telling us about it.
I'm so
Um,
glad.
uh, I do have a question to start, and then if everybody will just add questions to the chat, we can go from there. My question is, how much of the work is kind of state? Do you think is state and versus federal, and then that you guys do, and then how much do you guys do any kind of work with like local areas as well, like municipalities?
Yeah, that is exactly what we do, is that dual focus, because that's where the chapters are such a vital part of what makes us unique as an organization, that the chapters are what allow us to work at that state level. And most of these things, like maternal health, we would like to really be large scale federal bills that are going to, right now, our priority bills are beefing up emergency rooms for obstetric emergencies because of hospital closures, making sure that we're including lactation services and midwifery and doula services within Medicaid coverage, but those are even state by state based. And especially something like paid leave, we're really attacking at a state level, because that right now is so state by state. And I think the more that you look into how these things work, the state has so much power over the actual, even the federal projects that get funded. Like, that funding usually goes to a state agency and how it wants to work. So we really work hard at that state level, and we give chapters the space to decide what's most important to them at a given moment, and make sure that we're able to support it with whatever they need. So our Phoenix chapter, for example, has been a huge maternal mental health and lactation focus, and they've gotten 4 different state bills passed in, I want to say, 2 years, just like going like really hard on attacking state level legislatures and understanding how those work. And then I'm just, yeah, so states providing maternity and paternity leave is right now the best way that we're going to get it, is state by state. We are advocates for the Family Act, which is big national federal leave. We are pretty clued into what the appetite level is for that and the likelihood of it passing, and it's not really high right now. So we continue to push for it and do what we can, but we're also really working hard at state levels to change state legislatures' minds, and that's where hearing from their own constituents is really powerful. So one of the arguments that we'll get, say, if I go talk to someone in South Carolina, if I'm using California as an example for anything, they're not likely to say it's applicable. This is, South Carolina is different, Georgia's different. Like, it's not gonna, but when I can come and bring South Carolinian moms' perspectives to the South Carolina legislature, they're a lot more open to hearing that need and those asks. We think Pennsylvania and North Carolina are 2 states that we're really pushing hard at getting state level maternity, paternity leave. But that's a great example of something that will likely continue to be state by state in the foreseeable future. And we also, so the local level is really interesting, because this is something where local municipalities. So Charleston is one where, again, Janet and our team there know that zoning laws really impact childcare facilities and how childcare facilities can open and operate. So she knows enough to really focus at saying, hey, let me go to the Chamber of Commerce just of Charleston, and let's look at zoning laws and how we can make that friendlier to childcare. So a lot of these things do have incredibly potent components, even at that local level, if you're willing to really look and see, like, where is the opportunity here. And that's why a chapter model lets us do that. Like the chapter, whoever comes into the chapter might have more expertise again in what is the city of Greenville doing about zoning for childcare spaces. And there are thankfully not any more laws that should get in the way of breastfeeding and lactation, but like how do we make sure that there are spaces covered there? That's a big thing that we've been looking at, making sure that we've got coverage for as well.
Yeah, that's one of the things that we are trying to get on our map and recognize as a coalition is places that offer safe spaces to breastfeed, right? So we have this lactation resource map that helps you identify providers, because that's part of the barrier, right? If having done this for all these years in South Carolina, I can't myself figure out who provides lactation services. And the same comes to when people are trying to breastfeed, where are they going to do that safely? So if you guys are working on that, that's it. This is a really great partnership between
It sounds like it.
that we could have a really nice partnership between the coalition and Chamber of Moms. So,
and I think those are the exact things that we love, having partnerships to let us know too, that there are often details of this work that get overlooked by people not doing it day to day, which is where, again, the Babes Enhancement Act came in, where it was like, we know TSA has a directive to allow breastfeeding supplies and breast milk through, but not like a forced legal parameter. And so that was one where people just brought that to us, and it's like, yeah, that that seems like something we should be able to do. And a lot of those kinds of fixes make a really big impact on people's lives day to day, but they don't seem like a big deal to the decision makers. And they're also something they don't see unless they're getting that input from people actually doing the work day to day.
Right. And it is in the details. I mean, absolutely. It's in the details. It's in those processes that you use daily. And then you find things you're like, well, that just doesn't work.
Yeah.
Or we don't have that written up, So
exactly.
Mm-hmm.
I run our military chapter as well. My husband's a service disabled vet, and we represent active duty veteran and spouse moms within the military community. And that's been a great example of things like, TRICARE covers doulas, but they came and told us they have to report in 15-minute increments. It can only be, a set number of minutes within a 24-hour period, like these things that make no sense for how actual doula care works. And those are things that we're able to then bring to TRICARE and say, can you fix this? And if not, let's go see where it can get fixed. But it's exactly that. The details of like TRICARE covers doulas is like true on paper, but not actionable for moms in real life. And those are the exact kind of fixes we try and go look for. We have a similar one where TRICARE covers certified nurse midwives, but not certified professional midwives or certified midwives. And that's just because that law was written before those other two licensures existed. So everybody agrees that that's absurd and we should cover all of them. And it's just having to go get that law changed. And I've been able to make the case that it's a big deal because birth centers primarily use certified midwives and certified professional midwives, which means that women using TRICARE are then often not able to go to birth centers, despite what TRICARE is intended to do with the law. So a lot of what we do is clarifying intent, because not a lot of moms were consulted when a lot of our laws were written. So making sure that we're able to go back and do those fixes. And we love those things being brought to us. So as people see things and have ideas for especially state and local laws that are not meeting the intent, especially of what they're supposed to do, we would love to hear about any of those issues that we can hopefully look at finding a remedy for.
Okay. And you said right now you've been working on give us a quick list of what you're working on in South Carolina right now. Is that okay? Do you mind doing that?
Yes,
Just
yeah.
to
And
kind
I
of
would love to
review.
send a
Mhm.
more thorough list if that's okay with bill
Yeah,
numbers
that'd be great.
and
Mhm.
whatnot. If it's easier to send by email, or I can send it to you and can send out, or if people have requests for it. We unfortunately spend a lot of time playing whack-a-mole here in South Carolina with laws that come up around reproductive health and maternal health. But that's why these kinds of networks and chapters are important, because when something comes up and we hear there's testimony, we have several members who went and stood in line for 3+ hours to be able to give testimony about recent bills that were going to affect rights and access to maternal health care and reproductive health care. And that's the kind of action network sometimes you need. They don't always make that super public because they don't want tons of people to come out and give testimony. So as a chapter, we're able to share that information quickly so that people, if they feel compelled and empowered to do so, can do that. We're looking forward to one day continuing to be more proactive about trying to expand access to healthcare and childcare. But that's the flip side, is sometimes you have to play defense as well. And we also make it clear that just continuing to have the conversations is the work. So going to Columbia, meeting with legislators to really put forward, this is the state of childcare in South Carolina. This is the state of maternal health in South Carolina. And this is what the reality of paid leave is for mothers in South Carolina. And just laying the groundwork that continues to be an issue and keeping it, we say, on the front burner. So not letting moms' issues fall off and be out of sight. We met with one South Carolina federal legislator who will remain nameless, who looked us in our face and said, "We don't really do women's stuff." So we know what we're up against. It's only been one. But that was a moment of how do we pull this into something that you care about and make it clear that more than half of your constituency probably cares about women's stuff, but also everyone is either a mother or has a mother, right? So this is something that needs to continue to be issued. Not be in the conversation if chapters weren't continuing to keep it conversation.
It's breaking up a little bit. Sometimes if we just give it a second, it'll come back.
Okay.
There we
Is it
go.
back? Okay.
Yeah, I think we're back. Yeah, I don't know what
Okay.
happened. Just a blip in the universe, right? Maybe a sun flare or something.
Yeah,
Who
we've been
knows?
getting those awful storms here. I don't know if they're everywhere or if there's anyone here in the Bluffton area, but just these giant electrical thunderstorms. We had to buy a new router this week because it's been nuts. Yeah.
Yeah. We've had awful storms here in Charleston as well, but I know people in our neighborhood, at least one person in our neighborhood lost a router this week as well. It's been bad.
Yeah.
So
Yeah, they were almost sold out at Best Buy when we went to buy.
Wow, that's amazing. That's incredible. Unfortunate. So I think we missed the last couple of things you were saying just at the very end there, just because you were cutting out.
Oh
Do you
no.
remember exactly? And it's okay, because I know when some stuff comes out of my mouth, sometimes I'm like, I don't know what I just said.
No, it was, if there was any other clarity
Yeah.
around the question I missed, let me know. But
Okay.
otherwise, yeah, I just hope we'll share how to join, how to follow us. We have our national accounts on Instagram and Facebook and Substack, where we like to share information out. And we also love to share information from partner organizations. So if there's ever messages you as an organization would like to get out, we'd love to highlight that as well.
Okay, and we have an e-blast that we send out. So yes, we can work together on that. Wonderful. Does anybody else have any questions? I don't see any in the chat right right now. Maybe some will pop up. I do want to, again, thank you so much for sharing this information. Thank you
Yeah.
for being here. We appreciate your time. We appreciate your passion for doing what you're doing. Yeah, thank you. Thank you for
Thank
sharing.
you. Thanks for having me.
I did want to, I know that I think there were also some questions for Suzanne. We have a few more minutes in the meeting. So if anybody would like to ask Suzanne, I know she was going to stick around for a couple of questions. There's one here from Dawn, and it says, Suzanne, can you talk a little bit more about your process of shadowing other LCs and how you got into this?
Yeah, so okay, so the process. So I reach out to a lactation consultant. Currently, it has been all private practice. I would love to reach out to somebody in like a hospital setting. Um, but I've been able to get approval and permission from private practice, so that's who I've been shadowing so far up to this point. But I show up and I shadow them for a half a day for a couple of lactation consultations, and I make my little notes, and then I go back and I will write a blog post, and it's really just what I notice they're doing really well. So I'm focusing all on the positive things. It's not a what not to do. I'm just saying, okay, what are they doing really well? What could I potentially implement? And then I just make a post of what I noticed that they're doing that I think it could really impact myself and really impact other lactation consultants. I also have a podcast, which is super exciting. Natalie, who spoke today, was my first lactation consultant shadowing guest on the podcast. So I would love to do more of those where I go shadow somebody for a day and then we just chat. And I'm like, oh, I noticed that you did this, this, and this really well. Tell me more about that. Um, so that's what I'm doing. I got into it about a year ago when my second baby was born. Um, just because I've always wanted to continue learning in this field. That's just one of the things I love doing is learning, and I think this field is so fascinating. And so I thought if I'm going to be doing all this learning, I may as well share what I learned and just kind of see how it goes, especially since I'm not seeing patients right now. I love this career, and it was a little bit sad stepping away from it for like temporarily, but I mean, my babies need me more right now. So I figured doing this will I'll kind of keep my fingers in the game so that when I do go back to seeing patients, I won't feel totally blindsided. But but yeah, I love it. So if anybody wants, it would be interested in me coming and shadowing you and learning from you, let me know. Send me an email because I would love to hear from you and come shadow and just kind of see and learn what you're doing really well.
Thanks, Suzanne. Yeah, that's a great idea. And I feel like, we all kind of work as our little, sort of like our little islands, even if you're in the hospital setting, obviously you have, or in a practice where you have more than one person, but you're still mostly, kind of seeing people by yourself, unless you have unless you have people following you. But those people who are following you often aren't giving you feedback of, what I'm saying? Like, so it would be, it's really helpful for somebody to kind of go and see what people are doing and then bring back this feedback, right? And tell us tell us, hey, in general, this person's doing this really well, and this could probably improve everybody's practice if they did it, right? So it's an interesting concept, like to do this. I certainly haven't seen it. And I'm not a Facebook user, or like I don't use that avenue very often, or other social media. So I don't know, who's doing what, doing this kind of thing. But to me, it seems like a very novel concept. So
I used to teach, and years ago, a decade ago, I taught at a school I think they did a great job of putting their kids, their families as their first priority, and then really supporting the teachers. And they had all of the teachers, one thing they made us do was go sit and observe other teachers in the school. And I think we were all much more cohesive because we were sitting and watching other teachers and figuring out what they were doing well and how they had this layout or how they answered that question, and it was just like little things that I learned that I can't learn from a textbook. just by observing somebody. You just learn different options.
Right. And, teaching and what we do have so many commonalities. I mean, we teach, right? We spend we listen. And I think teachers probably, listen as well, like in the classroom, but probably not as much. But that teaching, that help actually teaching is really important. And I think that, we have these communication credits that we have to do for IBCLE, right? And it seems like, those learning some of those formal teaching skills would probably be useful in general for the practice, not just general communication skills, but also some teaching skills, so.
Yeah, absolutely.
Yeah, but let's see if anybody else has another question. Let's see.
Wondering how open other LCs and private practices would be when asking one practice for opportunities to learn from them. I have had more success than I expected to have, because it is a very personal thing. Like, I'm coming in and I'm watching you with your patient, so I need permission from the lactation consultant and from the patient and all that stuff. But I've had people are way more open than I had thought. I got a couple people who aren't interested or have got too much on their plate or just, not interested in it. But I have been impressed with how many people have been willing to let me come learn from them.
Mm-hmm.
And I think posturing it that way, I think, helps a lot too. Because I don't know, just posturing it as I'm just here to learn. I think that helps too. I don't know, but I've had more success than I expected.
And also, you don't really have your own private practice right now, right?
Correct. That is true. So it's not
So
like
that-
I'm competitive. Yeah, you're right. Yeah, I'm not seeing patients. I don't have any plans to create my own private practice. So that is another aspect of it.
Right. But I do think that, I agree with that sentiment that often we have a lot of competition where we need to hopefully be working together to try and see as many mothers and babies as we can, because we know that there's so much more need out there than we're meeting, so. Any other questions? Sarah Glenn just said, wish we could collaborate more, less competition. Absolutely. Completely agree. So I just want to say thank you to everybody for coming today. Really had a great group here today. Really appreciate Suzanne and Angie for talking to us and sharing their expertise, their knowledge with us. It looks like there's a link in the chat that Dawn just put up as well for her for those CEs. Really appreciate everybody sharing what they did for World Breastfeeding Week and just everybody introducing themselves. This is a coalition, so it doesn't work unless everybody talks and learns who we are in the state, who everybody is. So thank you again. Please consider joining if you are not a member. Membership is $25. That includes SERPs. Quite a few of our meetings have SERPs associated with them. And those are free to members who pay at the $25 level. If SERPs are not a consideration and you feel like you can't support at the $25 level, please support us at the $10 level. And of course, if you can do more than 25, we always appreciate it. Please check out our sponsors on our website. We put our sponsors on the first page of our website. And please consider joining us. We do have some places open on the board, as I mentioned, and looking at the bylaws, it is usually at least a 5 to 10 hour commitment. And everybody on our board, we don't have any staff. Everybody on our board is committing to working as staff, unpaid staff for our organization, and getting things done. So it's not it is an advisory committee, but it is actually a working committee to get things done for the state to promote, protect, and support breastfeeding. Please look that up. We hope to see you in October at our October meeting on fourth Wednesday of the month, which I believe is the 28th. Thank you so much. Thanks.
Thank you.
Thank y'all.